listener, and welcome to the Southern 7 podcast. I do hope this isn't your first time joining us, but if it is, I'm Shauna Ryan, Community Outreach Coordinator for Southern 7 Health Department and Head Start. The Southern 7 podcast is a service provided by Southern 7 Health Department to help you and your family live better and stay healthy, and is recorded at our central office in Olin, Illinois. Southern 7 serves the lower 7 counties of Illinois with public health clinic sites and Head Start centers in each of the counties we serve. If you like today's episode, please share it with a friend, and if you haven't done so, make sure to check out our other podcasts on the Southern 7 app, on Spotify, and through our website at southern7.org. Well, listener, just in case you didn't know, the lower 7 counties in Illinois sit inside one of 3 hotspots for various cancers, especially colorectal cancer. Now, the hard part is that this area also sits inside what those in healthcare call a health desert, which loosely means that healthcare needs are often reduced or not met for various reasons, such as lack of advanced treatments, fewer facilities, longer travel times to a clinic or hospital, and other cultural or socioeconomic factors. But fortunately, we at Southern 7 and other healthcare facilities in our area don't let it stop us from helping to meet the cancer care needs of people in our region. And we know you won't either. That's why you're listening today. To learn more about this year's Cancer Warriors Walk for Hope, to be held in Metropolis, Illinois on October 5th. Now, healthcare providers from our region's 3 hospitals, which are Hardin County General, Massac Memorial, and Union County Hospital, and our 2 federally qualified health centers, which are Community Health and Emergency Services and Rural Health, along with Southern 7 Health Department, the Hope Light Foundation, and others, are teaming up for the second year to raise awareness and funds to support cancer programs close to home. Now, what you're about to hear is the first of 3 episodes in our Cancer Warriors Walk for Hope series about this remarkable effort to combat cancer for those we serve every day and what it means to those living with and or caring for someone with cancer. It could also save your life too. So without delay, let's get started with episode 1, FQHCs and Public Health, Vital Grassroots Cancer Care.
Southern 7 Health Department and Head Start, making a difference in your community, one family at a time.
The second annual Cancer Warriors Walk for Hope is coming October 5th from 10 to 2 at the Dorothy Miller Park in Metropolis, Illinois. Your whole family will enjoy this one-of-a-kind event, complete with games, food, and activities, a tour through a 20-foot inflatable colon, the chance to meet local cancer care providers, and so much more. It all starts with the Warriors dedication ceremony at the Hope Light Lighthouse at 10 a.m., followed by the walk along Memorial Path on the banks of the Ohio River. All proceeds benefit cancer programs in Southern Illinois. For more information, visit Cancer Warriors Walk for Hope on Facebook or call 618-634-2297. Presented in partnership by Hardin County General Hospital, Massac Memorial Hospital, Union County Hospital, Rural Health Incorporated, Community Health and Emergency Services, Southern 7 Health Department, and the Hope Light Foundation. Welcome back to the Southern 7 podcast. I'm so excited to be able to bring our podcast today out to the communities and what we're doing. We are getting ready for our Cancer Warriors Walk for Hope, and we're going to be presenting you a series of podcasts here in our region. Today we're going to be talking with folks through our federally qualified health centers and their involvement in the walk and what they want to have come out of this event, as well as the services that they provide to you all here in our community. So we're going to go ahead and get started. But first, we're going to go around the room, have everybody introduce themselves, tell us where they're from and what they do there. So Chase, let's start with you.
Okay. I'm Chase Heilman. I'm the Community Outreach Coordinator with Rural Health Incorporated.
Great, Chase. Good to have you. Chris?
I'm Chris Morgan. I'm with Community Health and Emergency Services, also known as CHESI, and I'm the Quality Director.
Okay, wonderful. And Jody, who have you got with you today?
Well, Mandy Butler, she's our Director of Nursing, but she actually just got an emergency phone call, so she stepped out, so I'll step in for her. But I'm Jody Stewart, the Chief Operating Officer at Rural Health.
Great, Jody, thank you. And are you expecting Mandy to come back, or is she, if she's going to be gone a while?
I think so. She got a phone call about an accident, so here she comes. She's back. Mandy's back.
Very good. Hi, Mandy.
Hello.
Mandy, tell us who you are and what you do there at Rural Health.
Oh, Mandy Butler. Yeah, I'm the Director of Nursing here at Rural Health.
Okay, good. And we've also got Rochelle. Rochelle, we'll have you go ahead and introduce yourself.
Good morning. I'm Rochelle Morgan. I'm the Community Navigator with the Illinois Breast Cancer and Cervical Cancer Program. I look forward to this event.
Very good. Well, glad to have you all on this call today. And what we're doing, listener, is we're going to be presenting you with an opportunity to hear 3 different podcasts about the Cancer Warriors Walk for Hope. And today we're going to be talking with predominantly, like we said, our members from our federally qualified health centers, also known as FQHCs. So if you hear that acronym, that's what we're talking about today. But again, folks, we're going to be talking to you about this year's Cancer Warriors Walk for Hope. It's going to be coming up on October 5th in Metropolis at the Dorothy Miller Park. And the purpose of this event is kind of twofold. One, it's to, first and foremost, introduce you to cancer programs in our region right here in the lower 7 counties in Illinois. It's also an opportunity for you to meet some of those folks, to find out what cancer care is available to you here close to home. And it's also an opportunity for you to connect with providers in our region if you are yourself looking for a primary care physician, if you're wanting to talk with our nurses and other members of those teams. So it's a great opportunity for those of you who are maybe starting your cancer journey, or have had a family member who's going through cancer treatment, or if you're just wanting to get some information about what's available here at home. So that's the purpose of this event. Now, the second thing that we're doing this year is giving you an opportunity to participate in the walk as a sponsor, in terms of whether you're supporting the event through financial services to help the event be successful, or if you want to participate in the walk. So we're going to share some information with you about that as well, and where those proceeds will be used and how we will be using those. But first thing I want to do is just to kind of go around the room and talk with you, or talk with our members on our call today, and have them explain what cancer services are provided at their facility, what are some things that they do with the community. So I tell you what, Chris, we're going to start with you at CHESI. Tell us a little bit about the cancer programs that you offer there at CHESI and how people can connect.
Okay, first of all, we are the Illinois Breast and Cervical Cancer Program, also known as IBCCP, which Morgan is part of. So that offers cervical and breast cancer screenings for people in our area if they're uninsured, underinsured. Even if they are insured, we can also be a navigator. So that is a service that serves these seven lower counties. So that means low cost or no free or free screenings. Also, if turns out that there is a cancer, we can fast track that patient into Medicaid and we can guide them through. So that's one of our programs that we have here. We've also partnered with Southern 7 and Illinois Cares for, I believe we're going on year number 5 for colon rectal cancer screenings. That includes FIT kits, Cologuards. Currently, CHESI does offer, if you are a patient here and you're underinsured or no insurance and you need a Cologuard, we can get that at no cost to you. The FIT tests are available through us and Southern 7. Illinois Cares also now has a program now that we can offer free colonoscopies at Hardin County Hospital. Usually we have 3 slots. Unfortunately, they are not being taken advantage of. So I'm always pushing any individuals, patients, or employees that screening is key. So those are the programs that we offer here at CHESI. We have 8 locations.
Wonderful. Okay, so a lot for people to take advantage of right here close to home, especially those first steps of screenings. Rochelle, do you have anything you'd like to add?
I also get a chance to work on the Wild Van, the Wellness on Wheels, with the wonderful Southern 7. So I'm super excited about that. So when they travel out to different locations, we're on the van with them to help to introduce our clients to our Illinois Breast Cancer and Cervical Cancer Program and attend some of their needs as well.
Very good. Yeah, we love having you guys on the WOW Van with us, and CHESI brings a whole new opportunity for our patients here close to home. If you're thinking about mammograms and things of that nature, that is something that you can get here close to home. So they are providing that as well. Thank you so much. We'll come back to them here in just a bit. Chase, tell us about some of the programs that are going on with Rural Health.
Well, Jody and Mandy may be able to help me out and elaborate a little bit more. But I know at our Anna Clinic, we provide OB services, and we also provide genetic cancer testing through Invitae. I didn't know if Mandy, if you want to jump in and provide a little bit more about that or not. But I do know we provide that.
Mm-hmm.
Yeah, we offer those services at all of our sites, and it's the hereditary cancer screening. Most of the time, insurance pays 100%. If not, the most the patient is out of pocket is $100. And we can test for the BRCA genes. There's an 84-panel test that's usually ordered. And then we can add, like I said, BRCA genes, Lynch syndrome panels. And then if those come back positive, we can dig a little further and they can do RNA testing to break down some of those genes and exactly find that mutation and where it's coming from. And that helps the patient, if for further treatment, if they need to increase their screenings, get their screenings earlier, more often, if there's any surgical interventions with the BRCA gene that they can do. So that's offered at all 5 of our sites.
Right.
And in addition to that, we do the basic, PAP screenings for cervical cancer, but pretty much everything else is a send out and a refer and follow. The breast cancer screenings, mammograms, the colon cancers, those type of things, colonoscopies, that's all refer and follow. We don't have any specialists here that perform any of those on site. Again,
Even more screenings here close to home that people can take advantage of. And I know at Southern 7, Chris mentioned that we partner with CHESI and through Illinois Cares on the FIT program. And the FIT stands for Fecal Immunochemical Test. And it's an early screening test for colorectal cancer. It does not replace a colonoscopy, but it does get that starting point for somebody who maybe hasn't had a colonoscopy in the last 10 or so years, or is at higher risk for colon cancer. So that's an opportunity. Like Rural Health, we also provide genetic cancer testing through Invitae at each of our 7 public health clinics on the WOW van, and are looking at ways to expand that program. And incidentally, I know Rural Health has had a success with that program. We have here at Southern 7 to the point to where we have expanded that to other health departments throughout the state. So genetic cancer testing is pretty much becoming standard operating procedure when you go in and talk with your doctors. So it is a test that you can get here close to home, and there are ways to help you cover that cost. So just know that is an opportunity for you wherever you are. We are going to be having FIT kits as well as genetic cancer testing at the Cancer Walk. So you can come out to that event and get information there as well as get tested. So a lot to offer there. And listener, you probably already realized that we here on this call all work closely together in a lot of different avenues, not just in cancer, but in a lot of different ways we work together and partner together. And in doing so, we also reach out into our communities around us. The lower 7 counties in Illinois do not offer advanced cancer care and treatment, but the folks that are on this call and in future podcasts that you're going to see about the Cancer Walk are able to get you started. They are able to follow you through your cancer journey, make sure you're connecting with the doctors that you need to. And if it comes to travel, there are some things that we can do to help with that, including helping you with, screenings of some kind or blood tests of some kind. So, you may be in a rural area, but you do have access to advanced care here in our region as well.
And I was going to add also regarding mammograms, one of the best kept secrets is that we do mammography in Caro at the CDX. You do not have to be a CHESI patient to have a screening mammogram if you meet that criteria. And I can tell you there's no waiting. A lot of people don't realize that's offered here in Dynamic Caro.
Oh, great, Chris. Thank you so much for bringing that up. Well, let's go ahead and talk about a little bit about that. Let's kind of expand on what he's talking about there. In terms of patients in our region, do you all take patients just in the lower 7 counties? Do you take them throughout the region? What do you see there?
We also get patients from Kentucky, and we get some from Missouri. It's depending on the payer-based MCOs if they are available. We have a very generous sliding fee, so people do not realize how affordable to see a provider is. But the Illinois Breast and Cervical Cancer Program, if they're not in those lower 7 counties, then we refer them to an Illinois Breast and Cervical Cancer Program in their county. So it's not like, sorry, you're not in Alexander, you're in this county. We can refer you out. Okay. So you do have contact with others that you can make sure that patient is getting the care that they need. Correct. Exactly. Good. Chase, Mandy, Jody, what about you all at Rural Health?
Well, I mean, I might just speak real quick. I know we definitely see patients. I mean, we're in Union, Johnson, and Massac counties. Our clinic, those are where our clinics are at. But I know we have patients that come from neighboring counties, and it's kind of just like what Chris said. We have a great sliding fee program, and we definitely see a lot of people from more than just the area that our clinic's in. And if Jody and Mandy want to add anything.
The only other thing I can think to add to that is we also have an internal program set up to where if we have indigent patients that are unable to pay for diagnostic services or high-cost medications, if they submit the paperwork, it goes through a vetting process, and we can assist with paying for that. We've actually covered the cost of several CAT scans, MRIs, specialist appointments, things of that nature. So patients that fall between the gaps of that sliding scale fee and insurance, we're able to pick up some of that cost for them.
Also, Jody, don't you do a lot of referrals? We get a lot of our referrals from your organization as well. I love Rural Health because you're constantly sending women over to us. So thank you for that.
Well, thank you.
Yes, thank you.
Well, and we know that cancer treatment is very expensive, and a lot of the patients that we see cannot afford even just basic screenings. So to hear that you've got opportunities for them, whether it be covering some of that cost, I know that we see that with our genetic cancer program, our FIT program. That means a lot for patients here in the region. And Chris, you mentioned earlier that we do have a partnership with Hardin County General to help cover the cost of that, of your colonoscopy, which can get rather expensive. So, patients need to understand that, while a cancer diagnosis is frightening, that we can help them through that, and we do have connections. So, and I'm assuming, I just, because I know we do here at Southern 7, you all connect up with doctors and medical facilities throughout our region, not just in Illinois, correct? Correct. And one more thing about that, Illinois Cares those colonoscopies in Hardin County. They also provide lodging for the night before for one and a guest, and it can also do some reimbursements for mileage and meals. Exactly. Thank you, Chris. So because a lot of times we like if someone has that free colonoscopy that we can provide, free Cologuard, and it's a positive, then that's another way that barrier of payment helps. Yeah, because a colonoscopy is not cheap. The process is not, but yeah, they do help make it as easy and as affordable for the patient as they can. Very good. All right. Thanks, Chris, for bringing that up. Appreciate it. Let's talk a little bit about anything that's upcoming in your programs. Are your facilities seeing cancer screenings that are coming forward? Anything new that's going on in your locations? We're going to be working on trying to work with Cologuard as far as going through our gap reports and stuff and trying to see that we have can get some more screenings. We've had success. Exact Science, which is Cologuard, has been very supportive in this area, and also they have a wonderful portal, and I cannot always say the word wonderful when it comes to a portal, that helps us track those tests well. We even have it set up now, so like one of the things is those Cologuards are picked up by or supposed to be dropped off for a UPS, when of course we do not have a large amount of UPS stores in this area, so we can always use this clinic as a hot spot for pickup as well. Okay, great. What about with Rural Health?
Nothing I can think of that we have upcoming that's new.
Okay. I'm sure there will be at some point for all of us as cancer care continues to grow and change. I know we're all, having the conversations about new cancer or lung screenings. Those lung scans are becoming something that we're going to be hearing more about. HPV. Do you all provide the tests for HPV? Are you doing that in your facilities?
Yes,
we are.
Yes.
Yes, we are.
Okay. So that is something that you're doing. And we, here at Southern 7, we vaccinate against HPV, and we don't actually do the screenings. I mean, I know, a couple of you said that you are doing some of those tests, but we provide the vaccination here at the department. Now, as far as the cancer walk comes up, we want people to realize that the reason that we are doing this, we already talked about the basic reasons, but we all live and work in a hotspot for cancer throughout our region, not just colon cancer, which you hear a lot about, but for a lot of different cancers. So we feel it is important for people to realize that, cancer screening is here. It is available to you here. The information is available here. And these are folks that you can come and talk to and get information from. Folks, Chase, we'll come back to you. What are some of the things that you want people to get out of the cancer walk? Why is it important for people to attend this event?
I think it's important for many reasons. One of the biggest, it's a way to celebrate those who've survived cancer, recognize those who may be going through it, and remember those who may have lost their lives to cancer. So it's a great celebration all around for those reasons. But also, like you mentioned earlier, it's a great way to find out that you have so many resources around you, because a lot of people think that if you want care for certain things, you're going to have to go out of state. You're going to have to go to the big cities. And that's not always true. I mean, our facility, CHESI, everyone that's involved with this walk provides so much care to all the residents in the region. And it's a great way for folks to learn what they have around them, for sure with cancer, but also like last year when we did the walk, so many people came to us who just were looking for a family doctor, and they came to the walk and they talked to us, and they got a lot of info about things they needed to know for not only themselves, but their family. So it's a great reason to come out and learn just a little bit or a lot about what's around you and what you can have access to for your health.
Exactly. Right here close to home. Exactly. Mm-hmm. Thank you, Chase. Appreciate that. Chris, what about you? What do you want people to take away from the walk?
Again, know what's available out there, because we have more than $2 generals. So there's more that these rural counties have to offer. But again, like Chase was saying, that people do not realize, I mean, like just when I was talking about doing a mammography in Carroll, there's a lot of they just assume that they're automatically going to Carbondale. And also that at these events, it's a time that if someone's the education, you can talk more about the procedure or the test itself. Like colonoscopies, I know a lot of people are very, very leery of colonoscopies whatsoever. My father had colon cancer, and I've had a colonoscopies every 5 years since I'm 25, and I'm in my 60s. So you do the math, but you have to tell them a different way to approach it. I think, it's kind of like a Zen moment. You do some fasting, you go in to have your colonoscopy, you get a little happy juice, and you start fresh the next day. Yep. So it's a lot of just getting over those fears of what is involved, especially a colonoscopy, Cologuards, fit test, and then there's the germ factor of that. But I mean, it's just literally letting someone know that it is easy and it is available.
Well, yeah. The fact that what he's talking about too is that knowledge is power, and that's one thing I've learned since working down here in the southern region. The lack of knowledge has been such a great fear for so many people down here. So I'm super excited when you go to the walks, which are so much fun. You do get to talk to some physicians, you get to talk to other partners, and really get together and explain there is no fear. Knowledge overcomes that fear, and that's one of the tools that I use down here with a lot of the people that we service.
Exactly. And you're talking to people like Chris, who's gone through it. I've gone through breast cancer treatment. I've had colonoscopies. We've all gone through something. And we're comfortable in sharing that information and let people know that we've gone through it too. We know exactly what your fears and your concerns are. And like Rochelle was saying, knowledge is power. And when it comes to dealing with cancer, if you can, have cancer detected early, or if you know that it's something that runs in your family genetics, it is something that, if it's caught early, in a lot of cases, it's very treatable or manageable. So, that's what we want people to understand. We don't want cancer to be something that, that you're constantly afraid of, even though we all are to some degree. But there are resources here for you. And the Cancer Walk is to provide you with that. Exactly. Jody, Mandy, is there anything else you'd like to share? Anything you want people to take away from this event?
I maybe just the wonderful group of network and resources that we do have available. Mm-hmm. I think a lot of times we get forgotten about down here in the region that we're in, but I think everybody works together and we have a great network of people that are willing to assist in programs.
Exactly. And she's right. I mean, the vendors that are going to be out at this event are going to include our 3 hospitals in our region, Rural Health, CHESI. There's going to be some mental health facilities there, as well as some fun things, just some general bounce house kind of things and food and just an opportunity to have a good time. So we just encourage everybody, if you can, to take some time. Again, the event's going to be on October 5th at the Dorothy Miller Park in Metropolis from 10 to 2. Doors will open at 8, but all the fun stuff probably won't get started until around 9 or 10. And we just want you to come out and have a good time. Before we go into all the details about the event, is there anything else that people want to share, that you all want to share with our listeners about the cancer programs in your region, or just anything in general about your locations?
I don't want the women down here to always say, I don't want to know. This is something you do want to know. Take it personal. This is your life. So that's something that I constantly preach. You want to know. You want to know what your body, what the condition, you want to know about preventive. This is what this is about.
Mm-hmm. Well, yes, thank you, Rochelle. Chris?
I agree.
She's a very strong advocate for you all, isn't she, Chris? She is.
She does her job well.
Anything else about your facilities, maybe that's not cancer related, that you want people to know?
I could say we also offer dental. We also offer behavioral health. And again, especially another desert down here is dental and dental hygienists, but we do offer dental at these locations. We have behavioral health for both adults and children. And again, just check out. The way you find things out is ask. And that's one thing that in this area that all these organizations is we work together and we try to make sure that if we don't have the resource, we find one, because it's a challenge to live in Southern Illinois. We have, I remember 2 years ago, the term was low hanging fruit. Well, we don't have a lot of fruit around here. So everything hangs high up there. So anyway, that's it for me.
Very, very well said. Very well said, yes. Chase, did you have anything else you wanted to share about Rural Health?
It's just like what everyone else is saying. But, we provide 5 clinics, Anna, Vienna, Dongola, Goreville, Metropolis. We offer family medicine, behavioral health, dentistry. We offer a lot: medication-assisted treatment, hepatitis C, screenings and treatments, kind of a one-stop shop. Mm-hmm. But yeah, like what everyone's saying, with all of our locations and with all the networking, there's so much help around us all that it's a shame if no one takes advantage of it. And what Rochelle was saying, knowledge is power, and that's the key. Just if you think something's up, or if you want to know where you stand, take advantage of everything around you. Rural Health will help you. CHESI will help you. We're all in this together.
Exactly. And go ahead, Mandy. Jody, do you have something to share?
We also started our National program here to help treat patients. So we got the FibroScan machine. We can do FibroScans for our National program, and also for the hepatitis C program that we offer here. Mm-hmm. And our dietitian, she's involved in the National program, referrals to her. And yeah, so we've seen a lot of success with that program.
Very good. Wonderful. Jody, do you have anything else to add?
No,
No? Okay, well,
I
great.
think they covered all the bases.
Very good. Well, and here at Southern 7, we do a lot of shots. So if you're needing a vaccination for something, you can give us a call as well as anybody here on this call. Like we've said, we all do work together very well, and we refer patients to each other constantly. It's probably kind of an unusual situation, but like Chris said, when you live in where we are in literally a health desert, we rely on each other very, very much. So I want to thank you guys so much for participating in this effort with us and in everything that we do. I know I probably drive you guys a little bit crazy, but it's because we just appreciate everything that you're doing and want you to know that we do want to work with you in any way that we can, because a lot of times we serve the same patients, but then again, we don't. So, it's important that we continue that effort. So thank you so much for that. Once again, about the Cancer Walk, for those of you who are wanting to know a little bit more about it now, you can visit the Cancer Warriors Walk for Hope Facebook page. All the information is right there. There is an opportunity for you to actually participate in the walk, and registration on that is just $25. You can go ahead and get that signed up and come on out and walk with us. If you'd like to be a vendor at the event, give us a call. Setting up to be a vendor doesn't cost anything, but if you would like to support the event, we really would appreciate your help on this as well to help us get the information out there. All proceeds from the walk are going to be split between Rural Health, CHESI, Southern 7 Health Department, and our 3 hospitals, as well as the Hope Light Foundation, to help us to be able to expand our programs. Because, like Chris was saying, we got one program when it comes to colon cancer where we're able to get free colonoscopies. But it would be nice to occasionally be able to offer some other free services, or maybe some gas cards, or just to be able to help us to bring new, cancer programs into our region for folks here at home. So all the money that's raised through the walk is going to stay right here in the lower 7 counties, and so we're happy about that. So please take some time to visit the Cancer Warriors Walk for Hope Facebook page. You can also visit us on Instagram and get all the information that you need. So again, check that out. The event one more time is October 5th from 10 to 2 at the Dorothy Miller Park in Metropolis. We'd love to have you come out and see us.
Well, that wraps up another episode of the Southern 7 podcast. Thank you so much for joining in with us. We appreciate having you with us today. If you'd like to hear more about this year's Cancer Warriors Walk for Hope, we do encourage you to listen to our other 2 podcasts in the Cancer Warriors Walk for Hope podcast series. You can find it right here where you found this episode, so make sure you check it out. We're going to have more information from our partners in this effort, including give you a chance to hear information from our hospitals as well as some of our other partners in this effort. So make sure you check those out. Again, from all of us here at Southern 7 Health Department and all of those associated with this year's Cancer Warriors Walk for Hope, we hope you have a wonderful day.
Southern 7 Health Department and Head Start, making a difference in your community, one family at a time.
The second annual Cancer Warriors Walk for Hope is coming October 5th from 10 to 2 at the Dorothy Miller Park in Metropolis, Illinois. Your whole family will enjoy this one-of-a-kind event complete with games, food, and activities, a tour through a 20-foot inflatable colon, the chance to meet local cancer care providers, and so much more. It all starts with the Warriors dedication ceremony at the Hope Light Lighthouse at 10 a.m., followed by the walk along Memorial Path on the banks of the Ohio River. All proceeds benefit cancer programs in Southern Illinois. For more information, visit Cancer Warriors Walk for Hope on Facebook or call 618-634-2297. Presented in partnership by Hardin County General Hospital, Massac Memorial Hospital, Union County Hospital, Rural Health Incorporated, Community Health and Emergency Services, Southern 7 Health Department, and the Hope Light Foundation.